because your skin will impact your perception of self. Your skin is represented inside your brain. And why is that? It's because a long time ago, when you were just one cell old, when you were a little zygote inside your mother's womb, at that point, the outermost layer of the embryonic layer, which is called the neuroectoderm, that layer divides into two, and half of it becomes your brain cells and the other half becomes your skin cells. So your skin cells and your brain cells arise from the same matter. Happy weekend. How's everybody doing? Happy New Year. New Year, same longevity hour. Hopefully, one of the things that I'm gonna say I will intend to do this year is I will try to be more regular with my appearances. I try to come on every weekend and answer any questions that were asked over the week from us, whether you guys did it on other social media, or whether you called and asked, or whether you emailed and asked, or whether you texted or asked. I try to answer your questions once a week, but sometimes there are weeks that I am unable to come in, and then your questions start piling on. Again, for those who do not know me, this is Dr. Din. I work at Giovanni. I am a longevity medicine doctor. My office is in New York. And if you are somebody who is interested in taking care of your body and being good to yourself and living a healthy life to the maximum potential that your body may grant you, then you may want to follow me. And I am open to questions that I would try to answer truthfully and honestly to the best of my knowledge. I have been a doctor for over 2 decades and in New York, and I'm both certified in family medicine. I'm a retired geriatrician. I retired almost 14 years ago to pursue longevity medicine. Actually, my path in geriatrics was something that brought me to this newly developing field of anti-aging medicine, which is also known as longevity medicine. And it has evolved very rapidly. I mean, when we say rapidly, I mean in the last 12 years. So not so rapid, but still there has been progress every single year. And we are now situated in a very different location where we were 10 years ago. So a lot of things have changed. A lot of thought and how we viewed skin has changed. And, it is what it is. So nice to meet you. This is Dr. Din, and I'm here to answer your questions. Tell us more about your new Ultherapy device. So, for those of you who do not know what Ultherapy is, Ultherapy is an anti-aging device. It is a device that is specifically constructed for your skin, and in United States it is FDA approved, FDA cleared for skin, for a non-surgical facelift. It is considered to be a non-surgical facelift. I tell everyone that at some point in your life you may need a surgical facelift, but every other year you will need a non-surgical facelift. And non-surgical facelift, if started on time, will allow you to keep your skin intact and it will not fail. Basically, what this is these are frequencies of sound that we place under your skin. And As your skin goes through time and gravity and hormonal changes and stress and atmospheric pressure changes when you travel from one place to another, or lack of sleep or lack of hydration, whatever are the effects that result in your skin degrading over time, these frequencies, when placed in a certain part of your skin, will resuscitate your skin and resurrect it. Basically, your skin, it has three layers. There is like a top layer where you meet the world, and there is a middle layer where all your problems are located, like your collagen, your pigment, your blood flow, blood supply. All those things are in the middle layer. And then there is a deep layer of your skin where your skin meets the internal world of your body, and all the three layers of your skin come together to create the appearance of what your skin looks like. And as you go through time, basically these three layers of skin fall apart. They lose their content, they lose their shape, they lose their elasticity, they lose their integrity. And one thing that we have found to be super useful is to place these frequencies of sound, which are very tiny. These are non-surgically placed under your skin by a medical doctor or somebody who has trained in the use of this device. And we basically recommend it once or twice a year when you are younger. And when you're older, this is something that we like to do every time you come for an anti-aging medication. These medications do not remove your need for other anti-aging medications. For example, if you are somebody who's doing an anti-aging medication like Botox or hyaluronic acid fillers, or even intravenous infusions of things like NAD and high dose vitamin C and glutathione and all the B vitamins that your doctor can lay their hands on. So when you are doing those medications for your skin and it's anti-aging, you still need the tightening with the sound frequencies. And the frequencies of sound have been patented by this German company, which is called Merz Aesthetics. So these guys have, just like they have the Mercedes, they also have the Merz. So this device is created by this German company that has patented these frequencies, and everybody else in the world is trying to copy these frequencies, but they can't. They just can't. There are some Chinese alternatives that are cheaper, but they don't last that long. There are some European alternatives that are also in the market. And right now, I think last year, there was like a treatment device that was approved in United States, which is also kind of a copy of this machine. However, the original, the gold standard in non-surgical facelifting tools happens to be just this machine. So this is a machine that we have been utilizing for the past 12 years in our office. And last year when these guys came up with an upgrade, because I think very soon these guys are gonna be getting the clearances to lift other parts of the body also. So I went ahead and purchased the new device also, which is called Ultherapy Prime. So by the way, I did not make an exchange. So a lot of providers of longevity protocols also created, they did like an exchange. So they gave in their old machine and they got like some discount and then bought the new machine. I, however, kept my legacy machine because the legacy machines, I already have 2 of them and I really like those machines, and they've, we know them very well. So I wanted to also try the new machine, so I have both. So the new machine is slightly bit more expensive. It has great results. I've already done at least 10 lifts, and all the people that I've done are super happy. The results are faster, and the best thing about the new machine that I really like is that it is less painful. Because remember, Ultherapy is, for those of you who've had this treatment previously, just know that Ultherapy can be painful. And in my office, we always like to give you some pain medications with it, so that you can tolerate the experience, and it doesn't like rough you up too much. But the thing is that the new machine is much less painful, which is always good. How soon will I see the results after an Ultherapy treatment, and when will they peak? That's a very good question. So Ultherapy is, when you do Ultherapy for your face, you're basically investing in your skin. You are placing these frequencies. These frequencies do not last for too long. They last only like 6 to 9 months average, and you have to repeat it because basically it's like a retoning of your skin. Because it's a non-surgical facelift, what ends up happening is that you will need a little time. The face starts manifesting the results in like 4 to 6 months. And usually I like to tell people that by the time you start noticing the lift and the tightening, and people start commenting that, oh wow, have you lost weight? You look great. At that point, just know that it is time to redo it and repeat it. So yes, it is like a 401k in your skin. If your skin was an investment, this treatment would be like a 401k, because it's going to manifest signs for you much later. And these are additive signs, because you're going to every year prevent your skin from failing. Because one of the things that I also want to, again, I know I say this all the time, but maybe you are somebody who may not have heard me say it before. So here goes. I'm going to repeat myself, because life is about repeating yourself again and again until the message becomes clear to that person who's supposed to hear it. So your skin is not only the largest organ of your body, but it is also the most expensive organ of your body. Your skin holds the seeds of your consciousness. Every cell of your skin is important, and your skin, as it goes through time and space and gravity and hormonal changes, it will lose its shape and form, and it will also fail and fall. When your skin fails, it falls, it hangs, it sags. One of the other things that people also need clarification is that your hair is nothing but an extension of your skin. And one of the earliest signs of skin failure is hair loss. So Ultherapy has nothing to offer for your hair yet. However, Ultherapy is FDA approved in United States for a non-surgical facelift. And these are frequencies of sound that we place inside your skin, which allow you to keep your form and keep your peaks and keep your connection with your perception of self a little while longer. Because it needs to be repeated, because it's a regular thing. It is something that should be added in everybody's regimens, especially when they have peaked in life. For instance, if you're now 35 or 40, you've expanded and contracted because you have gained weight or lost weight, and you've created a family for yourself, and now you're entering your perimenopause or menopause. At that point, you may have peaked, you may have achieved the best of your life. At that point, this is the point to consider how to preserve your perception of self, because your skin will impact your perception of self. Your skin is represented inside your brain. And why is that? It's because a long time ago, when you were just 1 cell old, when you were a little zygote inside your mother's womb, at that point, the outermost layer of the embryonic layer, which is called the neuroectoderm, that layer divides into 2, and half of it becomes your brain cells and the other half becomes your skin cells. So your skin cells and your brain cells arise from the same matter, and That's why they have this entanglement and this connection at birth, which we were not aware of a long time ago. But now we are becoming aware of it as the reality of human skin is unfolding. So a lot of these devices have been in the market assisting people for longevity medicines protocols. However, the problem is that these are still very new treatments and they're not covered by your insurance, because your insurance does not cover anything related to skin, because insurance thinks that anything that has to do with skin is cosmetic, unless it's a rash that's causing trouble or unless it's cancer that's causing trouble. They're not gonna cover it. So all the things that you have to do for your skin are basically out-of-pocket costs, and people have to put up with these costs anyway themselves. So if you're in United States and you're waiting for your insurance to cover these medications, you'll have to wait for a very, very long time. So Ultherapy is one such machine, and it is one such device that will allow you to hold your connection with your perceptions and versions of self that you like best much, much longer. And it's going to be very useful, because if you do it regularly, you'll never need surgery. You'll never need to excise parts of your skin that have failed. Normally, what went on like 10 years ago, the thing that people used to do is that they would let their skin fail because there was nothing to save it with, and then they would go to a plastic surgeon and they would excise the parts of skin that has failed, that have grown, because remember, your skin grows all your life. So even if you did plastic surgery, it would still grow and keep growing, and 4 or 5 years later you would again develop like a jowl here and a sag there, and women and men had to keep going again and again until they start looking abnormal, because they've done 2, 3, 4 surgeries every 4, 5, 6 years, and now they're looking like really off because they don't look like themselves anymore because they've been cut so many times. So Ultherapy is that device that solved that problem of the chronic growth of your skin, and by preventing that chronic growth, we basically save the skin. What are the best skincare things to do in January and February? So your skin, just like you go through the seasons, your skin also goes through seasons, and there are several seasons. Like if you do the wrong thing for your skin at the wrong point in time, you might have some side effects. So for instance, we also have devices such as lasers. Now lasers are these devices that harness the energy of light. So if you do any light treatments on your skin during, let's say, summertime, for instance, if you've done like a hair removal laser, or if you've done like a pigmentation laser, or if you've done like a IPL, which is an intense pulse light, or even a BBL, which is a broadband light laser, if you've done any of those lasers during summertime, you have basically placed yourself under some kind, your skin into in this danger of getting pigmented. So I like to tell people that the best time to do any laser treatments, especially in my office, the best time to do any laser treatments would be in the dead of the winter. So, and why is that? Because during winter time, not only there's less sun, but there's also less heat. So, and laser can get your skin sensitized to not only sunlight, but also heat. So it would just absorb more sun and more heat, and that can create pigmentation and the color changes and hypopigmentation or hyperpigmentation in the baby layers of the skin. And then what ends up happening is that those dark spots may not become evident right away, but 10 months later, suddenly out of nowhere, you will have like a pigment showing up, and when those layers come on the surface 10-15 months later, you would have even forgotten when you did that laser. So a lot of people, when they do lasers, I always tell them, please try to do your lasers in the winter time. So January and February, you still are in the safe zone for laser. So if you're thinking of doing a laser, which is especially resurfacing, especially if you're a white person who is more prone to developing skin cancer, you should be doing resurfacing lasers on the exposed parts of your skin, and they should be done in the winter time, in the dead of the winter time. If I have rosacea, how many laser treatments are necessary to reduce it? So, what is rosacea? Rosacea is a skin condition where if you feel that your skin, your cheeks and your skin, your facial skin or other parts of your skin get very, very red after you eat cheeses or drink wine or have anything spicy, or sometimes just like that, it is because sometimes the blood flow or blood supply of the skin that usually is in the middle layer of your skin sometimes starts, those small tributaries of your blood supply start attacking the top layer of your skin, and they start growing into it, and that the top layer of your skin does not like any blood flow in it, and because it's a barrier, it likes to keep its barrier very, very intact. Now when these when the blood flow starts going into the top layer of your skin, that's when a lot of people start developing inflammation, and we call it rosacea, this red tomato red cheeks, or nose, or sometimes it's like blotchy all over, and that condition is called rosacea. And when you go to your dermatologist, they would give you antibiotics, low dose antibiotics for months and months to stop that inflammation from turning into acne and creating scarring and basically just irritating your skin, because as it irritates the top layer of your skin, it actually causes breakages and it causes rapid aging of that area. So but the moment my problem with those things is, there are like several topical things that people give you, but none of that works. And I know this for sure because I have rosacea, and I've suffered from rosacea for such a long time. And one of the reasons that I purchased one of my lasers very early on in my journey into skincare was because of rosacea. And this laser that I have is by Sciton. It's a broad-based light laser, and it is best known for its rosacea treatments. And what it does is that it beats down, so you'd need like 3 or 4 treatments depending on how bad your rosacea is, but you need to do these 3 or 4 treatments once a month. And once you complete them, basically it wipes out your blood supply that is encroaching upon the top layer of the skin, and basically beats it down to the lower layer levels, and that just cures your skin, and it relieves you from your rosacea symptoms for at least 2 years. And I tell everyone, please try to do it like 3 times in a year, and then do the maintenance treatments every year. So for instance, me, I am going to do my maintenance treatment later this year, and actually later this month, and it has, my rosacea almost never comes back. Now, do you have to still apply good skincare with it, and do you still have to do your antioxidants and intravenous supplements? Yes, you still need to do those, and they will also help. However, the best treatment for your rosacea is a laser. It's a laser treatment, and this is not it's a non-ablative laser. So again, the best thing about BBL is that it doesn't break your skin. It just creates this barrier and solidifies the barrier of the top layer without breaking the skin, and that's the best thing. Do you have any New Year specials? Yes, so the New Year special that I have running in my office, currently is if you want to try our Ultherapy Prime machine for a very short period of time, I am giving it at the price of our legacy machines, and basically I'm inviting people to try it because it's really cool. Okay, there's a question about Opus. Opus is the world's first plasma laser. The only reason I bought Opus was because it was very good for not just fair-skinned people, but also dark-skinned people. And it is, again, minimally invasive. If I do Ultherapy Prime, do you recommend doing the treatment only once a year? So if you are in your 20s, you may not need Ultherapy Prime unless you became pregnant and gained weight, and now you've lost weight, and then you are now seeing some signs of sagging anywhere, you can do the Prime. At your age, it's not that necessary. However, when you're in your 30s, because women usually peak sometimes in their 30s, and when you've peaked in life and you're like, wow, I look the best, this is it, I don't think I'm going to ever look better than this, that's when you need to start doing Ultherapy. And if you do it once a year, it's great if you can afford it, because it's so expensive. I don't like to tell younger people to do it too many times. However, if you have the resources and money is not a problem for you, then sure, do it. There's no downside to it. However, just know that when you do Ultherapy, it is like skin tailoring. So just know that whoever is your skin tailor, they know what they're doing, because again, it's like when you're doing earlier on, when I was telling you about the laser treatments, when you do lasers earlier in life, in a wrong month, like if you do it in summer, you may, after a year, you might start seeing blotchy patches here and there. It's because you've just damaged the skin, and the damage just manifests like a year, 2 years later. Similarly with Ultherapy, if you go to somebody and they start tightening you incorrectly, you may look a little off 2 years later, and then you will have to like change the whole regimen and the way they are placing the energy around your face to to go back to your previous versions of self. So it can change your perception of self, and that's why I say that find your skin tailor very, very carefully. So yeah, once a year or once every 2 years when you're very young. But when you are in perimenopause, and when you are in especially postmenopausal or post-andropausal years, you should do it 2 or 3 times a year. Your eyeshadows are gorgeous. Where did you get them? Thank you. I think this is Huda Katan. This is Huda Katan's palette my daughter gave me as a Christmas gift. So she's my makeup manager. What makes someone a good candidate for Ultherapy Prime? Old age. Ultherapy Prime, if you're aging, if you're in menopause, if you're in perimenopause, if you're in your 40s, if you are and sometimes skin failure hits you earlier in life, just like sometimes you might find someone who is young and has heart problems, or who's young and has some other problems. Skin is also an organ, and sometimes people's skins fail earlier in life. So whenever your skin starts failing and you start noticing that it's like draggy and saggy, or you've like gained weight and lost weight and now you have like sagging skin, this may be one of the things that you can do. Now, if your skin has grown too much, there is no way for Ultherapy to fix that. So you may have to go to a surgeon, get the excess skin excised, and then start doing Ultherapy. What do you think about the wildfires in LA? Listen, LA, what it feels like is that as if the climate change is colliding with the regime change that's about to happen in the United States. So on one side, there is, the LA fires are devastating. However, I don't know how this happened, because we're also hearing that there was like water issues and they couldn't fight the fires because the hydrants didn't have water, and somebody had shut off the electricity. So they shut off the electricity to prevent the fires from becoming bigger or something, and they couldn't pump the water to fight the fire. So that was like insane. So it's like a tragedy, and I hope that we learn the lessons that need to be learned. And I don't know, out of this thing, I hope that there will be lessons that will help us prevent such big disasters in future. What are the things you can do for Valentine's Day at my office in longevity medicine? Usually every Valentine's Day I always do something with HA fillers, and this time I'll probably do something with the lips too. Lips are our Valentine's Day usually carries lips. I may do a lip flip with Ultherapy. So if you've not experienced a lip flip with Ultherapy, that may be a good thing to experience, because sometimes we don't want to fill our lips because your lip is just fine, and this may work better. So if you've never tried Ultherapy for your lip, try it. That might be a good idea for this particular Valentine's. Will you be publishing any articles soon? I am thinking of, I have to do an article on one of my favorite new medications, and that's GLP-1 agonist, which are medications like semaglutide, also known as Ozempic, also known as Wegovy, which is also known as tirzepatide. And I love these medications. I like to mix them with some B12 and some liver cleanse, because these medications come with certain side effects that you may not like. And these are basically sugar neutralizers that will act like an iron dome of sugar neutralizing inside your body, because guess what? Sugar is a toxic substance for your system, and it is something that every time anything you eat, whether you eat something sugary or whether you eat something salty or whether you eat something carby or protein wise, they will all get broken into sugars, and our brain loves sugar. However, too much sugar is not good for its longevity, because it causes things like movement disorders and dementia later on in life. And your brain can not store the data for that much longer if it is exposed to sugar all the time. And especially the sugar spikes that we experience, whether we experience those spikes with just eating yummy foods, or if we experience those spikes because we are spilling cortisol because of stress, both those spikes are not good for us. And these medications have basically changed the landscape of how your body is going to age in future. And these definitely still need to be taken with a lot of caution. You have to make sure that a doctor is monitoring your doses, making the changes. You have to make sure that your doctors are adding the antioxidants and the minerals and nutrients that your body needs to keep itself healthy as we turn the volume down on your appetite and your sugar. So I am very excited about the GLP-1 agonist, and I do feel that for longevity protocols, they will become like the new favorite supplement that everybody should be on, at least as a microdose. So, and these are the best thing about these medications is that you need to just give yourself this shot once a week. And sometimes if you're very regimented and you follow diet and you're doing all the other things correctly, you may not even need it once a week. You might need it once every 2 weeks. And listen, new things are already in pipeline, which will probably need to be taken once a month. And the shape of the future of medicine is very bright. And I feel that some of these medications will turn the tide on healthcare and turn it from and convert it from basically being a sickness management system to actually a healthy and wellness maintaining system. And this will put health back into healthcare and create positive results, not just for us but for our future generations. So it is a miraculous new medication, and again, when appropriately used with caution, it is going to add many years to your life, and also it will add quality back into your life and into especially your future years, the later years in your life, where for most humans life becomes very, very difficult. As a retired geriatrician, I don't know if you don't know what a geriatrics is. It is the care of old people and older people, and especially in geriatrics, in geriatric years, if these medications are started earlier on in life, your geriatric years are going to be, you are going to just feel normal. You will have quality of life and energy throughout your life, and not just for the few years that you're young and vibrant. Why not be young and vibrant for the entirety of your existence? So the article that I am publishing is going to probably be the next one, will be on the fat metabolizers and the weight loss. So the best thing about Ozempic that people like is its weight loss and the associated weight loss. Because Ozempic or Wegovy and GLP-1 agonists are like Botox for your fat cells. They anti-age your fat cells. And you may like that aspect of their functionality. However, what I like is the fact that they're also sugar neutralizers. So they basically decrease so much inflammation. The people that my own clients and patients that I have given it to, when I go and recheck their blood work, not only their hemoglobin A1C is better, but their BMIs are better, but their cortisol levels are better, their cholesterol levels are better. Because remember, your fat in your body is like plastic in the system, and your fat cells are like forever cells. They never die. So these medications will help reduce your fat cells inflammation and basically anti-age them. So these medications, let me clarify, these medications do not eliminate your fat cells. They just relax your fat cells so they don't hoard all the stress and all the food and all the sugar that you are ingesting. So your fat cells will not only relax, releasing the stuff back into the bloodstream, and releasing the hoarding. But the thing is that, as you reduce your weight, we do recommend other measures to eliminate your fat cells also regularly. You need to do some blood test before starting GLP-1 agonist. Yes, so I always recommend checking everything as a baseline before you go on GLP-1 agonist, because how would you tell the difference? You would be able to tell the difference by weight and stuff, but I like to always measure the outcomes for everyone, because everybody is unique, and the dose at which you should be on should also be unique. And just like people who use anti-aging medications like Botox or fillers or skin tightening, they know that these things are continuous. And similarly, GLP-1 agonist also, when you start it is a continuous thing. It's not something that you stop. Just like when you brush your teeth, your ancestors may not, 200 years ago, may not have access to toothbrushes. However, since we know that toothbrushes and toothpaste exist, there is no going back. You have to brush your teeth every day, sometimes 2-3 times a day. So similarly, many of these longevity protocols are kind of forever protocols. There's not like nothing that is one and done. So just know that yes, even when you have hit your target and you are no longer in need of any further weight reduction, you still need to be on some maintenance doses. People with insulin resistance benefit from GLP-1 agonists? Yes. Yes. And insulin resistance is what? It's basically a form of pre-diabetes. And it exists in everyone because we are not only feeding ourselves too much sugar, but we are feeding ourselves irregularly, and we are feeding ourselves basically things that that create a chronic state of high sugar in our system. So these things will create a way out for your body, for especially the type 2 diabetes that exists in United States, and the epidemic of obesity. These medications are all, they're very good. They're going to be they'll be the front line in preventing future diseases. And for cardiovascular, I tell all my cardiologists, who are my friends, and whether they're not even my friends, I tell them, are you recommending these to your patients? And I think everybody should be on it. So guys, if you like this content and if you like to talk about stuff like this, please follow me. And also, if TikTok happens to get banned, please don't worry, because we're also on Instagram, we're also on Facebook, we're also on YouTube, and we'll see you in one of those other places. And just follow us and see, and please ask your questions, and I'll be very happy to answer them. All right, see you, take care, bye.